Just relax it on the pillow, and it's very safe.
So the only movement we're going to want to avoid, Eddie's going to set you up in this brace, is like hyperflexion.
Okay.
Okay. So we want to move it, we want to rotate it. Sometimes guys misunderstand and they think they're not supposed to move it at all. It's not good. So you bend it to about here, you'll extend it to about there. It obviously feels scrappy because it's been immobilized. Right? Do this. Okay, good. It's awesome. All right, so on to the next phase. We'll get Eddie to get you set up with the brace, and then you'll do this bracing program for the next 4 weeks, and you come back at the end of that time. So it'll be 5 weeks after surgery. We'll throw the brace out. And we'll start the start pitching up and down.
All right,
good.
I'm gonna custom fit this on you, so you don't have to worry about it.
Okay.
So I'm gonna trim it, custom fit it, and then it'll be easy to take off and put on. Every 2 weeks, you'll be open up a little bit.
Okay.
Open the range of motion a little bit more. So either towards flexion, which is bending point, and towards extension, which is a straight point. You see there's a pin right at 60,
Okay.
so the brace won't go any higher than 60 degrees, not flexing wise. You see, make sure it's at 30 degrees, so that's 60 degrees. Make sure you go back to the sling while you're taking a shower.
What about sleeping? Do I
Sleeping, have it on.
have it on?
Yeah, you have to have it on. So you want to keep this tab, a finger below the top of the brace, the foam piece, the finger below from your armpit. Good?
Yep.
So the Velcro strip, you want to get it closer to the D-ring so you know exactly where to stop. How's that feel right here?
It feels good.
Feel good? It's not squeezing anywhere.
No.
That's the key. Make sure it doesn't squeeze. You don't squeeze too much.
It's good.
Let me know when to stop.
Right there.
So that'll be your range of motion. That's 60 flexion. That's 30 for extension.
Okay.
60, 30. You feel pulling right there, right?
Yeah.
That's normal.
Okay.
And you can do this as many times as you want. You need to secure the brace. You see that hole right there? You take the sit tight into that. The reason why you want to have that so this doesn't go
Oh,
anywhere.
yeah.
Okay. I mean, you can move your shoulder. It's not a problem.
Yeah.
You can do this, and the wrist gonna limit you doing this. And you can do that as many times as you want. The incision is clear from the straps. This one is clear from the strap.
All
Alright,
Thank you.
my pleasure.
Sean, we've met.
Nice to meet you.
How are
How's
you?
it going?
Glad we finally got this thing done for you, huh?
Oh yeah.
So you doing okay?
Doing all right.
Good. So this is now your thing for the next 4 weeks, as you know, right? And the settings, as Eddie kind of told you, he put you on 30-60 right now. And what I did is I wrote out the date. So on the 14th, you'll increase the bending, but the straightening will stay the same.
Okay.
On the 21st, the bending will stay the same, but you'll get more straightening. Okay. And then on the 27th, you're gonna come see me and also see Mickey, the head baseball guy here, and we'll give you, more of your packet of stuff and everything on that day.
Okay.
All right. So we got to make those appointments.
Once
set up.
you-
Yeah.
You got to come out of this brace a couple times a day to bend and straighten your elbow. But it's also important that you're rotating your wrist too, so that it doesn't get too tight. And you can move your shoulder around as much as you like.
Can I do the rotating in the? I really can't do it in the sling.
You can do it a little bit,
Yeah,
but you're right. But I want you to come out of the thing so
Couple
you
times
can
a day.
move,
Okay.
so it doesn't get too tight. We just can't force all the way bending and all the way straight,
Okay.
because that puts a lot of pressure on this ligament. And as Dr. Altchek told you,
Yeah.
it's very important at this point. Now, hopefully Eddie also told you, when you come out of this splint, your arm can swell a little bit, especially your hand. Don't get worried, that's very, very normal. And if you make these two straps way too tight, the same kind of thing
Right.
can happen. So
Okay.
just loosen those up. And then moving your hand around and stuff will also help that in your wrist.
Yeah.
And my suggestion would be stay on the anti-inflammatory for another couple of days. just because of that same issue with the swelling. Alright.
Okay.
Now the brace has to be worn all the time,
Okay.
except when you shower and stuff. Obviously, take it off. And but I would like you to wear a sling in the shower, just because, listen, the soap falls and you don't put your hand out to catch it. You know, just the black cat is kind of lurking in our world here a little bit. We gotta protect that. Keep it dry though in the shower tomorrow. Saturday, I don't know if Grace told you, but it can get wet on Saturday. And then if these strips don't fall off, a week from this Saturday, you can take them off. But I wouldn't just arbitrarily, pull them off ahead of time. Don't leave them for the next 4 weeks. Your skin will get a little nasty. I mean, there are guys who do that. I would avoid that. Okay. Icing is up to you. You may want to for like 15, 20 minutes, the next couple days, a couple times if you're sore just because you're moving it. If you don't want to, it's not, a huge thing. It's not going to really change your outcome. And if you ice and you start getting numbness in the last 2 fingers, all that is the nerve is right there, so it can easily numb it, as you probably have known when you've iced in the past.
Is it just icing because it's sore, or is it just because?
Yeah, because he hasn't moved it now in 9 days, and now we're gonna get him moving it or whatever, and you might get a little sore for the first day or two if you do ice it, but if you don't, it's not a huge negative for you. Okay. If you want to get a little exercise starting tomorrow, you can sit on a stationary bike and do a little pedaling and do a little light leg exercises too if you want to get some exercise.
Sounds good.
Okay?
Alright. Thank you.
Alright.